So hello guys, today we'll be discussing about the topic which is called as a trigeminal neuralgia. So we'll be discussing under the heading of the definition, classification, etiology, clinical features, diagnosis, differential diagnosis and the management of it. Okay. So other names are Fother disease and Doleurex. Okay. So yeah, we are going to, what is this trigeminal neuralgia? This is a just kind of like sudden and severe shock-like pain occurring usually unilaterally in the area which is supplied by trigeminal nerve. Okay, so a kind of a sharp shooting pain which is usually occurring unilaterally over the area which is supplied by trigeminal nerve. Okay, which is the fifth cranial nerve. Now coming to the classification, so this is the classification. We have two types, trigeminal neuralgia type 1 and type 2. So what are the causes, what are the types? Idiopathic, primary, typical and classical. Okay, in the type 2 we have the symptomatic or secondary. Okay, now coming to the etiology, so what is the major cause of this is the neurovascular compression. Okay, neurovascular compression means, suppose this is the artery, nerve. Okay, what is this? Fifth cranial nerve which is present at the pons area. Okay, or the pons area. So adjacent to this area we have the artery which is named as superior cerebellar artery. So in this scenario what happens is the superior cerebellar artery, it tried to compress over the trigeminal nerve. So we can see this is the superior cerebellar artery. This has been compressing the trigeminal nerve. So a kind of a depression has been found here. Okay, so due to chronic compression, demyelination is going to occur. The myelin sheath which is present over the nerve would be removed. So this is going to cause the hyperexcitability of the nerve fiber, and that is going to cause the episodic pain which is called as paroxysmal pain, recurrent pain. Okay, repeated pain occurring over some period of time. Okay, this is not continuous. Okay, if it is continuous then it is type 2. Okay, this is constant nature. So coming to the etiology, first thing we have to remember is the neurovascular compression. The second one we have the superior cerebellar artery or any sort of the veins or both arteriovenous malformation and the aneurysms. Okay, so in case of the neuralgia type 2 we have some infections. Okay, diseases, multiple sclerosis, post-herpetic neuralgia, trauma, space occupying lesions which are called as intracranial tumors, and the tumor of CPA, what is called as cerebropontine angle or the Meckel's cave. Now, so what is the difference between TN1 and TN2 is the differentiating points are here the pain is going to last only for second and it is a paroxysmal, which means the pain is going to act for a short period of time. Okay, matlab there is a sudden peak, after that it will shut down. Okay, after some time, after 3 to 4 hours again this is going to start, again this is going to take a peak over here. Okay, so that type of pain is called as paroxysmal type of pain, but here it is called as a constant pain. Okay, here it occurs unilaterally, here it occurs bilaterally, here it is middle age and old age, usually occurring after 40 years, and here it is younger individual. So this is about the etiology of the trigeminal neuralgia. Coming to the clinical features. So coming to the clinical features, so in this clinical features we mainly study about the age, sex and site. Okay, so age mainly the women's age mainly 48 years, or it occurs middle and elderly age people. Okay, age, sex mainly the women's, and site is the Meckel's cave or the trigeminal neuralgia nerve. Okay, now this is a type of pain where it occurs mainly to the women's, and that to even the right side of the face. Okay, middle and old age peoples most commonly they are affected. Again, in this mandibular branch is more affected than maxillary and then ophthalmic branch. Okay, now coming to the clinical features or the pain characteristics, how it is, we have to write compulsory about the pain characteristics and the trigger zone in this clinical features. It is important. Here it is unilateral, short lasting, severe and lancinating type of pain. Okay, we have to write here 3 years type of pain. What is that? Short acting, severe acting, and then stabbing type of pain. Okay, and here it is electric type of pain is also present, paroxysm is also there. Okay, and this type of pain is a sudden attack. It is usually superficially over the surface but not radiating. Okay, and this is an episodic type of pain, recurrent and stereotyped. Stereotype means mainly affecting the females. Attack doesn't occur at the night or sleep. It doesn't occur at the sleep, but it occurs only at the person who are at awake, okay? And that even recurrent, occurs at episodically. Trigger zones are the nasolabial fold, besides the mouth, gums, chewing, speaking, smiling. Again, it occurs, the pain is going to be intense. It is so much severe that the patient का जो face है, so that is going to become like frozen or mask like face, okay? Here a patient might feel like weight loss or poor oral hygiene, okay? And there is no neurological deficit, which means there is no paresthesia or loss of sensation over that other areas, over that nerve, okay? So diagnosis, we have to do something called as like history, proper history taking. Second thing is the CT or MRIs, and third thing we have the carbamazepine response test. It means that we are going to give a dose of carbamazepine to the patient. We are going to recall the patient after 1 week. After 1 week, if the pain is subsiding, then we are going to be sure that this is the neuralgia case. We are going to go into differential diagnosis as the neuralgic case, okay? If it doesn't subside, if the pain doesn't subside, then it would be of other cause, okay? So diagnostic nerve block, we are going to give 3 nerve block, okay? Inferior alveolar nerve block, mental nerve block, and incisive nerve block, okay? If there is any kind of the nerve block is present, okay, then if mental nerve block is present, then it is neuralgic case. So in this way we are going to diagnose the neuralgia. Coming to the treatment part,